Tampa. The legislature is about to kick off a new session. Top issues include affordability, education, and also criminal justice. Tomorrow, Florida Matters Live and Local will bring you special coverage of Governor Ron DeSantis' State of the State address. That's tomorrow at noon. Today, there will be a little stage setting. Get a little preview with Florida Matters Live and Local coming up next at noon.
WUSF depends on contributions from people like you. And
Check.
Yeah. I just saw him outside the window.
Check.
bought and sold. Sarasota Opera presents its 2026 Winter Opera Festival featuring Puccini's La Bohème, Floyd's Susanna, and more. These performances run February 14th through March 29th. Tickets at sarasotaopera.org.
Americans have 3 days left to enroll for healthcare coverage through the Affordable Care Act for the year. But as we speak, the US Senate is trying to figure out if they'll vote to extend subsidies to help people pay for health insurance. President Trump said he may veto the law if it passes. I'm Matthew Petty, and today on Florida Matters Live and Local, what does the ongoing debate mean for over 1 million Floridians who advocates say could be priced out of the health insurance marketplace? If you rely on health insurance through the marketplace, what has been your experience and how are you preparing? And later, international student enrollment across the country, including here in Florida, has declined. We'll talk about why. Plus, USF sports, so much winning lately. How is that playing out on the sidelines and in front offices? We'll take your calls and emails on Florida Matters Live and Local. Call 813-755-6562 or email floridamatters@wusf.org. First, these headlines.
Live from NPR News, I'm Lakshmi Singh. The Justice Department has opened a criminal probe of the Federal Reserve. NPR's Scott Horsley reports that has drawn an unusually strong response from Fed Chair Jerome Powell.
The Federal Reserve says it received grand jury subpoenas late last week about the renovation of the central bank's headquarters building in Washington and Fed Chairman Jerome Powell's testimony about that project before a Senate committee. Powell says those are mere pretext. He says the threat of criminal charges is part of the administration's broader pressure campaign, designed to force the Fed to move more quickly in lowering interest rates. The president is getting pushback, however, from some senators who will vote on Trump's nominee to replace Powell when the chairman's term ends in May. Scott Horsley, NPR News, Washington.
The administration is tightening restrictions on members of Congress visiting ICE facilities. Lawmakers will now be required to submit requests at least 1 week in advance. We have more from NPR's Elena Moore.
In her memo, Homeland Security Secretary Kristi Noem argued that unannounced visits take ICE officers away from their normal duties. And she argued that visiting lawmakers are creating, quote, circus-like publicity stunts. The memo was made public on Saturday, but it was filed Thursday, just a day after an ICE agent fatally shot a 37-year-old woman in Minneapolis, sparking intense criticism and nationwide protests. And some Democratic lawmakers have already been turned away from visiting ICE facilities. On Saturday, 3 House Democrats said they were denied access to an ICE processing center in Minneapolis. Elena Moore, NPR News.
President Trump says Iran has reached out to negotiate with the United States after Oman, a mediator, dispatched its top diplomat to Tehran for talks. Anti-government protests have been roiling Iran. NPR's Aya Batrawi has the latest.
Trump told reporters aboard Air Force One that the U.S. could meet with Iranian officials and that a meeting is being set up. But he cautioned that the military is also looking at, quote, some very strong options. Trump said if Iran attacks U.S. assets in the Mideast, they will be met with a very powerful force. Iranian authorities have cut off internet across the country for 4 days now in a bid to stifle protests that they say are being stoked by, quote, terrorists. Rights groups estimate that hundreds of protesters have been killed in the demonstrations that began December 28th. Iran says security personnel have also been killed. Iran's Foreign Minister Abbas Araghchi repeated the government's position that foreign elements are fueling the violence. The government planned rallies in support of the regime Monday. Aya Batrawi, NPR News, Dubai.
Paramount Skydance is suing Warner Brothers Discovery for more information into its decision to again reject a takeover bid in favor of Netflix's, even though Paramount offered more money. CBS's parent company also says it will nominate directors to the Warner Brothers board to propel the deal. From Washington, this is NPR News.
Support for NPR comes from NPR stations. Other contributors include Fisher Investments. As a fiduciary, Fisher Investments is obligated to act in their client's best interest. Learn more at FisherInvestments.com. Investing in securities involves the risk of loss. This is NPR.
You're listening to WUSF 89.7. I'm Craig Kopp. NASA is moving forward with a plan to return an International Space Station crew of 4 due to a medical issue with one of those astronauts. As Central Florida Public Media's Brendan Byrne reports, it's the first time the space agency is cutting a mission short due to medical reasons.
Last week, NASA announced that one of the astronauts of the Crew 11 mission had a serious medical issue that requires them to come back to Earth for additional care. The agency said the astronaut is stable, but did not reveal the identity or medical condition. Plans are now underway to return the entire crew, 2 American astronauts, 1 from Japan, and a Russian cosmonaut. They'll make the trip back in the same space capsule that brought them to the station back in August. The crew will undock from the station on Wednesday, with a planned splashdown Thursday off the coast of California. The mission comes to an end about a month shorter than expected. NASA is now preparing to launch their replacements to the station next month in a SpaceX Dragon capsule. I'm Brendan Byrne in Orlando.
Animal rights activists were outraged in July when a video went viral of a fishing boat off the Florida Panhandle hauling a massive manta ray on board. The endangered ray was then sent to a SeaWorld in Abu Dhabi. Pinellas County Democrat Lindsey Cross has now filed a bill to prevent similar captures.
There have been some proactive steps that FWC has taken, but they're really delaying action on this until commission meetings that happen in the spring and the summer. And we really want urgency on this.
The bipartisan bill called the Manta Protection Act would close a loophole that allows endangered or threatened marine animals to be captured in state waters for education or exhibition purposes. We start off this week with the lowest gas prices in 5 years. AAA says the average for a gallon of regular unleaded is $2.67. That's a drop of 46 cents over the last year, and it's the lowest it's been since March of 2021. I'm Craig Kopp, WUSF 89.7 News.
I'm Amy Tardif, your Florida editor. How do those in power affect you? The WUSF Your Florida team explains state policy and answers your questions on air, online, and on social media.
Bok Tower Gardens hosts Starry Starry Night, celebrating science and art. Experience the night sky with space-themed presentations, hands-on activities, and connect with a NASA ambassador. January 24th. Details at boktowergardens.org.
This is Florida Matters, live and local, sponsored by Badawi Law. I'm Matthew Petty. Well, this year started with members of the U.S. House of Representatives trying to figure out how to extend subsidies for people buying health insurance through the Affordable Care Act marketplace. Subsidies are funds used to help people pay their monthly premiums based on income and level of coverage. Well, Democrats want to extend COVID-era subsidies to help keep costs down for those who depend on their health care through the marketplace. And most Republicans say it's more important to focus on preventing fraud and reducing government spending. And that's why the subsidies are at risk. Are you one of the people who gets coverage from the marketplace? Join the conversation by calling 813-755-6562. You can also email FloridaMatters@WUSF.org. That number again, 813-755-6562. Would love to hear what your thoughts are and what your concerns are, I guess, as we head into a year without those subsidies and perhaps the potential of those subsidies returning. Well, now the House has passed a bill, it feels like a bit of a game of will they, won't they, when it comes to the chances of having the Senate vote. Florida Matters Live and Local welcomes Chief Washington Correspondent for KFF Health News, Julie Rovner, who's been covering healthcare for 40 years. Julie, thanks so much for being with us.
My pleasure.
Okay, so advocates say if subsidies aren't extended, it means over 1 million Floridians could be priced out of their health insurance plans. And, months ago, people got letters letting them know how much their premiums would increase. Without the subsidies, on average, people were seeing monthly costs rise 100% or more. Just kind of walk us through those numbers. What were you seeing in your reporting?
That's right. People are seeing sticker shock, basically. It's not so much that the premiums are going up, although the premiums are going up. Premiums are going up around 20%. But with the changes in the subsidies, it means that the share of the premium being paid by the federal government compared to the share that's expected to be paid by the consumer is dramatically changing. And that's why people are seeing their premiums sometimes double or triple or quadruple. It's especially dramatic for people who are older, who are allowed to be charged higher premiums by insurers because they use more health care, and people who are towards the bottom of the income scale, who were going from getting basically subsidized for the entire cost of their health insurance plan. Some of them are now having to pay, even if it's only $50 or $100, if you're just barely over poverty, that can be completely out of reach for you on a monthly basis.
And those two groups of people you mentioned, seniors and people who are, at or below the poverty line, I mean, those are two pretty big chunks of the Florida population, right? Because we do have a lot of folks retiring here. There's a lot of people kind of working low-wage jobs in Florida, so presumably they're affected quite significantly by these subsidies expiring.
That's right. And I should point out, it's not really seniors. People who are on Medicare are not affected by this, but it's those people who are what we call the near elderly, the early retirees, the people who are, between the age of 55 and 64 who are being hit the hardest by these premium increases.
So walk us back to the end of the last year, because we had time running out on extending the subsidies. It seems now there is a bit of hope for an extension. So what exactly is happening?
That's right. So, the Democrats had been complaining about this really all year. It wasn't until the fall that it really sort of captured the public attention. And obviously, it was the Democrats who were trying to make a stand on this issue that caused the shutdown of the government for 43 days in October and into November. In exchange for reopening the government, the Democrats were promised a vote in the Senate, which they got, and except they did not get the 60 votes that would have been needed to extend the extra subsidies. But in the House, kind of surprisingly, a number of Republicans joined in a Democratic effort to force a vote on this. Of course, that happened in late December, so the vote didn't happen until last week. But 17 Republicans ended up voting with all of the chamber's Democrats to basically reinstate these subsidies because, of course, they expired on January 1st. And now it's gone back to the Senate where they have to decide, do they want to have the vote on this that failed in December? Do they want to try to come up with a compromise? And there's a group working on that. So we're sort of in this middle place where everybody is scurrying around trying to figure out what happens next.
Yeah, a lot of scurrying happening, no doubt. But I'm wondering kind of what happened in the last few weeks. Did lawmakers go back to their constituencies and get a barrage by people saying, hey, look, I'm terrified of my subsidies expiring, or just have a change of heart over the holidays? What do you think happened?
I think it's a combination of that. Yes, lawmakers went home and there was, a lot of people who got together, a lot of holiday parties and holiday celebrating. And there are a lot of people who buy their insurance coverage through the Affordable Care Act. It's about 24 million people. The Republicans keep saying, oh, it's only 7% of the population, but that's still many millions of people. Also, we're seeing pollsters who are talking to voters who are saying, this isn't right. We shouldn't be making even people who are not necessarily being immediately affected by this, saying we shouldn't be taking this money away from people who are trying to make ends meet at a time when affordability is such a large issue for the voting public. So I think it's a combination of hearing from their constituents and hearing from their pollsters about what it means to allow these extra subsidies to expire.
Yeah, affordability front and center, no doubt, for a lot of folks in Florida and elsewhere across the country. We're talking about Affordable Care Act subsidies. The House has passed a bill to extend those subsidies, which expired January 1st. The Senate, it's now in their court to decide. Want to hear from you too. Are you somebody who buys your health insurance through the Affordable Care Act marketplace? What kind of increase have you seen in terms of your premiums going up and then subsidies going away? What are you paying now? How are you dealing with that? Because it's been a couple of weeks now, so presumably you've had a chance to look at the numbers and see how that affects you. We'd love to hear from you. Call us at 813-755-6562. That's 813-755-6562. You can also send an email to FloridaMatters at WUSF.org. And with us for the start of this hour is Julie Rovner. She's the chief correspondent for KFF Health News. So the House passed that extension for ACA subsidies last week, and now discussions, as you pointed out, Julie, are happening among senators to maybe tweak it a bit and potentially pass their version of a bill. It's kind of complicated, though, so can you walk us through what exactly the House decided?
Yeah, it is complicated. Well, the House decided just to do the straight 3-year extension. These were additional subsidies. We should point out that there are always subsidies in the Affordable Care Act. That was sort of the deal in 2010 when the law passed that said, everybody else gets subsidized for the cost of their health insurance. If you're on Medicare or Medicaid, the government pays a big chunk. If you get an insurance from your employer, not only does your employer subsidize you, but the federal government subsidizes your employer to subsidize you and subsidizes you because you don't have to pay taxes on the value of that health insurance, which, these days employer health insurance, can cost $27,000 a year for a family. So everybody was getting subsidized except the people who bought their own insurance, people who were self-employed, people who didn't have job insurance. And so the subsidies that were originally in the Affordable Care Act were to help people afford their health insurance. In 2021, during COVID, the Democrats in Congress with Democratic President Biden expanded those subsidies and made them much more generous. And that turned out to be a key for a lot of people to be able to get health coverage. So enrollment on the Affordable Care Act exchanges doubled basically from about 12 million people to about 24 million people, which is where it was last year. And then the question was that expansion of those subsidies was temporary, not because the Democrats wanted it to be temporary, but because that was the only way they could get the votes to extend them in the first place. They were hoping that by the end of 2025, either Congress and the presidency would still be in Democratic hands and they could extend them, or the Republicans would change their minds and help vote to continue the subsidies. And that's kind of where we are now. We're seeing Republicans sort of slowly coming over. But, the Republicans have made it a point to oppose the Affordable Care Act since its inception.
Yeah.
In his first term, President Trump tried very hard to repeal it, fell one vote short rather famously. Late Senator John McCain turned thumbs down in a middle of the night vote. So you've got a lot of Republicans who are now stuck between constituents who are very worried about their costs going up and their longtime, disdain for this law in general.
Yeah, let's get a call in if we could. We've got Ashley on the line calling from St. Pete. Ashley, you're on the air.
Hi, my name's Ashley. I have been helping a lot of friends figure out what their options are given the recent changes to the Affordable Care Act. When the Affordable Care Act first came out, I actually worked as a health insurance agent for a year, and it's much different now. The best case scenario I've been able to find for a friend who's in her early 30s. She's been paying self-pay for quite a few years. She doesn't get a subsidy. She was paying $700. The best policy we could find for her now was $1,200, but her out-of-pocket max went to $7,000.
Wow.
So that's the best case scenario of all of the friends I've helped so far.
Ashley, thanks so much for that call. What about that, Julie? I wonder, that sounds like a pretty dramatic increase, kind of seeing your premiums go into the thousands. Is that sort of what you're seeing? And what options are there for folks absent the Senate deciding to pass their version of some kind of increase?
Yeah, that is unfortunately fairly typical, and this is without a subsidy. I've mentioned that premiums are going up around 20%. In some cases, people can drop down to a less generous plan, but then as we've just heard, you'll be expected to pay more out of your pocket before your insurance kicks in. It is difficult. A lot of people are simply going without insurance. They're looking for low-cost, lower-cost ways to actually get care, to go to free clinics or community health centers. Hospitals and healthcare providers are very worried about people dropping coverage because then they're going to have to try and make up the difference because people are still going to come seeking care, and they're either going to, be unable to pay their bills, or they're going to have difficulty. The providers are going to have difficulty collecting. This is adding on top of big cuts to the Medicaid program that Congress made last year.
Julie, hold that thought. We are going to keep the conversation going. We're talking with Julie Rovner, Chief Health News Correspondent, Washington correspondent, I should say, with KFF Health News. You can call in too. Tell us what you're hearing and seeing and thinking. 813-755-6562, talking about the potential for Affordable Care Act subsidies to extend. The conversation continues in just a moment on Florida Matters, live and local.
Support for WUSF comes from listeners like you and from Seitenbacher, with a new web shop. Healthy muesli, cold-pressed oils, and vegetable broth mix delivered to your door from right here in Tampa Bay. Details at Seitenbacher.com. Seitenbacher. Seitenbacher. The Florida Orchestra's morning matinees are back. Dive into Handel's Water Music, Mendelssohn's Hebrides Overture, Rogers' Victory at Sea, and more. January 14th and 15th at Ruth Eckerd Hall and the Palladium Theater. Tickets at floridaorchestra.org.
As the new year begins, the movement for trusted news continues, and you're a part of it. Your $20 monthly gift helps keep WUSF strong, local, and independent in a year when state and federal funding have disappeared. Begin the year by supporting the source you rely on. Join us at WUSF.org.
Welcome back to Florida Matters, live and local, broadcasting from our studios here in Tampa. I'm Matthew Petty. We're talking with Julie Rovner, the Chief Washington Correspondent for KFF Health News and host of What the Health podcast about Congress's ongoing discussions on ending ACA subsidies. Want to hear from you as well. Do you use the ACA marketplace? Are you concerned about your coverage for 2026 in the absence of those subsidies? You can join the conversation by calling 813-755-6562 or emailing FloridaMatters@WUSF.org. I believe we have James on the line. James, if you're with us, you're on the air.
Thank you. Thank you for taking my call. Me and my wife, we're both over 60, both self-employed. Our premium has gone from $1,200 last year up to $3,200 a month this year. It's just not doable. We're not going to have insurance, and we're trying to negotiate cash prices for seeing our doctor. It is just not sustainable for self-employed people.
If those subsidies come back, are you going to have? I imagine that would be a pretty good incentive to get back and get some insurance through the marketplace. Is that what you're thinking, James?
Yes. You know, we've looked at options, catastrophic plans, but the coverage is so poor and the deductibles, $20,000. It's just not worth buying the policy.
What would your message be to lawmakers right now then?
If you want to help small business, reinstate the subsidies.
James, thank you so much for your call, and hopefully things work out for you. That does sound like a pretty massive increase and, as you say, unsustainable. Julie, what about that? I mean, the notion that folks are just basically trying to negotiate cash deals for healthcare direct with their doctors. I mean, that does sound a bit extreme, but are you hearing other instances of that?
I am. That was exactly what I was going to say before the break, is that in some cases people are seeking out lower cost care, or they're seeking to, get discounts for if they have regular providers. But that's not really tenable in the long run. People are doing it for now, but how long those doctors are going to be able to, carry people who are paying, less than they would even get from insurance is really difficult. And, this caller is exactly the kind of person I was saying is getting hit the hardest, the people who are not old enough for Medicare, but old enough to be charged higher premiums. And I should point out that this is a real problem, a conundrum for Republicans, because a lot of these people are self-employed. They're small business owners. They're farmers and ranchers. They're people who tend to vote Republican. So this is, the people who are being hit the hardest are most likely Republican voters, which is, I think, why we're seeing so much turmoil here in Washington amongst Republicans about what to do about these expiring subsidies.
How much does the big, beautiful bill, President Trump's kind of spending package passed last year, sort of factor into what's happening now?
Well, as I mentioned earlier, there's almost $1 trillion in cuts to Medicaid, to the Medicaid program. And there are other changes to the Affordable Care Act that make it more difficult for people to get coverage. It has nothing to do with these subsidies. That was separate. But it will tend to lower the number of people with insurance overall. There'll be fewer people with Medicaid. There'll be fewer people on the Affordable Care Act exchanges. That puts more pressure on providers, on doctors and hospitals and clinics who will suddenly be, have to find a way to scramble to continue to serve people who come to them needing medical care. That was one of the reasons that the provider community ended up supporting the Affordable Care Act back in 2010, because the idea of having more people with insurance means that they are more likely to get paid even if they're getting paid less. Now they'll get paid nothing. So there's a big concern about what this is all going to mean for the health system writ large. So even if you don't have Medicaid or you don't have Affordable Care Act insurance, if you lose your local hospital, that can impact you even if you have good insurance.
Yeah, a lot of challenges on the healthcare front. We've covered some of those on Florida Matters Live and Local, but as we say, right now we're talking about the Affordable Care Act, obviously those subsidies going away, those COVID-era subsidies that kicked in after 2020, expired in January. Some Republicans having a bit of a change of heart. Democrats have been pushing to extend those subsidies. Of course, that was at the heart of that government shutdown, the longest in U.S. history last year. I want to hear from you as well. Are you somebody who gets your health insurance through the marketplace, or maybe you know people who have? Give us a call. What are you seeing? What are you thinking? What is your strategy going forward if those subsidies aren't extended? 813-755-6562 is the number. That's 813-755-6562. You can also email FloridaMatters@WUSF.org. Now, I should say we invited local Congresspeople Kathy Castor and Vern Buchanan to speak with Florida Matters Live and Local. They weren't available today, but the office stands for them to share their positions. In December, Buchanan, who's Republican, voted for what was called the Lower Health Care Premiums for All Americans Act. Julie, how does that kind of compare to what was passed by Congress last week?
Well, this is a lot of what Congress has been doing sort of the last several years, which is what I call nibbling around the edges types of changes that would not address this in particular. But these are efforts that Republicans have been pushing for years to do what they say they can to start to lower health care costs. There's a long way to go before any of that is going to either A, become law, because that bill is not really going anywhere in the Senate, or have much of an impact. It's one of the things that there's bipartisan support on is that pharmacy benefit management companies need to be more transparent. There's both sides say that they're pocketing some of these profits and keeping drug costs high, things like that. Not that don't go directly to what people pay for healthcare.
Right. I want to get another call in here if I could. Mokesh on the line. Mokesh, you are on the air.
Oh, hi. Thanks for taking my call.
Sure.
I'm a urologist, and I've never called into a radio show anytime. But this debate is so important. And our guest is a healthcare correspondent, right?
Yep, for KFF.
So this is the right question, and I think I know the answer. Where does our lawmakers' insurance come from? Do they participate in ACA?
That's a great question. Julie, I don't believe they do, but clarify that for us.
No, actually they do.
Oh, they do? Okay.
During the debate on the Affordable Care Act in 2010, the Republicans insisted that if Congress was going to pass this bill, that they were going to take part in it. So members of Congress actually get their coverage through the Washington, D.C. Small Business Exchange, part of the ACA. So, but they everybody says, oh, well, Congress should have to do this. Congress does have to do this. Not all of the staff have to do it, but many of the staff do. And members of Congress themselves do get their coverage through the ACA.
So are they like in the lurch by these subsidies expiring too? What can you kind of clarify that for us?
Actually, I haven't looked at what happened to the cost. Most members of Congress were probably not getting the subsidies, even with the expanded subsidies. They earn too much to, in most cases, to take advantage of these extra subsidies. So that wouldn't affect them. But I haven't actually looked at what how much coverage went up on the DC Small Business Exchange. I imagine it went up, around 15-20% as
Right.
it has in many of the other places around the country.
Yeah.
One of the reasons that the premiums went
we're
up.
We're going to have
Okay.
to leave it there. But Julie, thank you so much for your insights. Mokesh too. Thanks for that interesting question. Really set us on a little bit of a path there. Really appreciate your insights there, Julie Rovner, Chief Washington Correspondent for KFF Health News. Clearly, lots more to talk about, so we'll probably have to get you back on Florida Matters Live and Local, but I appreciate it.
Be happy to join you again.
Well, coming up next, many college students are coming back to campuses across the country today, but as WUSF reporter Nancy Guan will tell us, U.S. immigration policy has had a chilling effect on new international student enrollment. We'll have that for you when Florida Matters Live and Local continues.
On the next Fresh Air, best-selling author Liz Moore. The settings of her novels range from a troubled Philadelphia neighborhood to the apartment of a 450-pound shut-in to a remote children's camp where a child disappears. She'll talk about creating her characters and seeing where they take the story she's writing. Join us.
Great conversation on Fresh Air tonight at 7 on WUSF.
At WUSF, support comes from the people who listen, like you. Also, Badawi Law, offering legal services in personal injury, immigration, and auto accidents, with offices in Tampa, Florida. Office information and practice details at BadawiLaw.com or learn more on Instagram at Badawi Law.
Welcome back to Florida Matters Live and Local. I'm Matthew Petty. We're broadcasting from the doctors Lorraine Rubis and Neil Frankel studio at WUSF in Tampa. Well, universities across the United States are losing international students. Reports are tying it to the Trump administration's immigration policies. In fall 2025, new international student enrollment decreased 17% nationwide. That is a significant drop compared to the previous academic year, which saw a decrease of 7%.
Gives you the sense that it might be more worth your time to just look elsewhere.
Well, that was Aaron. He's a University of South Florida student from Trinidad and Tobago. Didn't want to use his full name because he's afraid of retaliation for speaking out about U.S. politics. What do you think? Do you think the drop in international students will affect how universities operate? Usually, foreign students pay quite a bit more than domestic students for the same degree. Or do you think schools should focus on students from the United States instead, as Governor Ron DeSantis is suggesting? If you want to weigh in on this conversation, call 813-755-6562. That's 813-755-6562. You can also send us an email. We're at floridamatters@wusf.org. Well, the Open Doors report from the Institute of International Education surveyed a group of U.S. colleges to see how their international student enrollment was faring. And WUSF's Nancy Guan has been reporting on this, and she joins us now. Nancy, thank you so much.
Yeah, thanks for having me, Matt.
All right, so what does the Open Doors report actually say about international student enrollment?
Yeah, well, like you mentioned, there's been a 17% drop in international students enrolling in U.S. Schools last fall.
And this is new students, right?
Yes, this is new students. This is not the total number of international students currently studying at U.S. campuses. So looking at the report, this drop is pretty notable because it's the largest decrease that we've seen in a while. Mm-hmm. Again, you mentioned last academic year, the drop was 7%. So, this is definitely an increase. I do want to note that there was a influx of students, international students who enrolled after pandemic restrictions were lifted. That's because there was that pent-up demand once, international students could travel to the U.S. and come here again. But after even with that leveling out, I think a lot of higher ed leaders are seeing this drop and connecting it to some of the policies that we've seen surrounding student visas.
Sure. And just going back to the kind of pandemic era, I guess, delay in students or hiatus or pause in new student enrollments from foreign countries, and then that surge. What sort of time frame are we talking about? It was like 2022 to 23 sort of era?
Yeah, I think we saw a huge bump in 2022. Mm-hmm. And international enrollment has generally increased since then up until the last academic year. This is nationwide numbers.
Sure. Okay, so as you say, a lot of folks are connecting the kind of policies on immigration that we're seeing from the federal level, and sort of connecting that to the decline in new student enrollment. I mean, how big a role do you think those crackdowns on immigrations and visas play in sort of that drop off in enrollments?
Yeah, I mean, in the higher ed space, I think a lot of people are pointing to these new policies. I do want to preface by saying that there's a lot of different factors that influence enrollment trends. It could depend on the state, even the institution's own policies, or even recruitment efforts that could influence those numbers. And then another thing, like the pandemic, after that influx, a lot of officials have said they're kind of expecting that drop off to come. But again, going back to those federal policies, I think, a lot of these policies have restricted the way students can get these visas. Just to give an example, the Trump administration has banned travel from at least 19 different countries, and that includes for student visas. And the political climate has been really contentious for international students. Just to recap some more, last May, the administration temporarily paused student visa interviews. And once they resumed them, they had implemented this new requirement that students have to make their social media accounts public in order for vetting. And last year, thousands of students had their student records terminated, which kind of put their status in limbo for a bit. Some of them have been restored.
Yeah, just explain that a little bit if you can. Like, how do you terminate somebody's student record? What does that even mean?
Yeah, I mean, essentially, reading the reports of what has happened at different schools across the nation, it kind of disappeared. It didn't exist in the system.
That would make your degree almost worthless as a student, wouldn't it? I mean, you wouldn't be able to sort of look back and say, look, this is how well I did during this degree.
It certainly made students really nervous and worried about whether or not they had the legal right to be in the U.S. to study anymore. Like I said, some of them, I think they've been working to restore those. But also hundreds of students had also had their visas revoked for things like protesting and speaking out over Israel's war in Gaza. So international students, they've been under a lot of scrutiny and pressure. And I think people are certainly pointing to these things as playing a part in their decision to come to the U.S. or not.
We're talking with WUSF's Nancy Guan about the dip in international student enrollments. That's new international student enrollments at U.S. universities. Now, maybe you've got some questions about this, or you want to weigh in on this conversation. You can do that by calling 813-755-6562. That's 813-755-6562. Perhaps you know some international students. Maybe you're a student yourself from somewhere other than the United States, and you've got some thoughts on this. You can also email FloridaMatters@WUSF.org. Well, Nancy, you spoke with Dr. Miriam Feldblum. She's the co-founder, president, and CEO of the nonpartisan nonprofit President's Alliance on Higher Education and Immigration. And this organization closely follows policies affecting immigrants and international students. Let's just take a quick listen.
What we're doing now is actually discouraging them to stay, deterring them to come.
So, Nancy, what exactly does she mean by that?
Yeah, I mean, Feldblum did tell me that there have been existing issues in the system, like backlogs for student visas, especially for countries that send a lot of their students to the U.S., like China and India. So there are issues that predate this administration. But what she means is that, the combination of different federal policies that we've seen, the attitude that we've seen from federal politicians and officials, all of that has more so deliberately deterred students from coming. I mean, looking at what happened last year, it's safe to say the administration their intention is to make the process more selective. Advocates like Feldblum would say, more restrictive. And I think this 17% drop is definitely a clue to people like her and education advocates.
Yeah. Are we doing some kind of detective work here, though? Because short of just asking people, why they had decided not to enroll, it's a bit hard to tell exactly why somebody might say, I'm not going to study in the U.S., I might go somewhere else instead.
Yeah, exactly. I mean, it's hard to say what each student is thinking, but I mean, we're starting to see this trend with the drop off. And I think, this fall, that picture will become more clear. So we're definitely waiting for numbers in the upcoming academic year too.
Just back to what Miriam Feldblum from the President's Alliance on Higher Education and Immigration was saying, I mean, discouraging international students to stay, but the overall enrollment has only gone down a little bit, right? So presumably students who are already here studying, working on their degrees, they haven't decided to just up sticks and leave.
Yeah, so the overall international student enrollment dropped by about 1% last year, so it did remain a bit steady. But again, just to note, that number includes, people who are also have graduated but are participating in their what's called OPT, optional practical training, which is, I think the temporary kind of work that they do related to their degree in the U.S.
And they get like a year after they've completed their degree to get through that, or does that depend on the visa?
So it depends on, I think, the area of study. Some people get 1 year. I think STEM students typically get about 3 years.
Mm-hmm.
Yeah.
If you're just joining us on Florida Matters Live and Local, we're talking with WUSF's Nancy Guan about the dip in new international student enrollments at universities in the United States, including here in Florida. If you've got a question or you want to weigh in, the number is 813-755-6562. You can email floridamatters@wusf.org. All right, so if you look at the University of South Florida, what does international enrollment look like here?
Yeah, well, I want to start off by mentioning that USF is the most popular university for international students, at least in the state of Florida. The school really prides themselves on that international student body. But they have seen...
I got to say, that is a little surprising to me because, I mean, it's not the biggest university in the state of Florida. I would have thought maybe other universities that have a higher profile, like UF potentially,
certainly,
maybe a little more attractive, but that's interesting.
Yeah, and they've been, consistently kind of the top destination for the last couple years. But looking at their numbers, the international student enrollment has dropped ever since 2022, ever since that, COVID bump, so to speak. Last fall of 2025, about 1,061 international students enrolled. And that's about a 266 drop off from last year.
Mm-hmm.
Again, it's hard to say why less students have enrolled at USF. The university didn't really comment on that either. But
Sure.
Yeah, it's something that they're watching, I think.
Yeah, I imagine universities might be a little reluctant to kind of weigh in these troubled political times. What about what Florida is doing? Because we've been talking about the federal laws and the impact of those, but there's been some changes in Florida law too. Can you talk a little bit about what's happening there?
Yeah, I mean, that's a great question. Florida has certainly kind of aligned themselves with the Trump administration in this, I think, America First mindset, in serving American students first, they would say. And in the last couple of years, Florida's passed their own laws that have made it more restrictive for international students or have kind of cut ties with foreign universities. So, for example, in 2023, Florida passed a law that prevented state universities and colleges from participating in agreements or partnerships with schools based in 7 countries of concern. And the state also recently eliminated a scholarship that allows students from Latin American and Caribbean countries to receive the in-state tuition rate. Typically they would have to pay the full out-of-state rate, but that scholarship is something that they got rid of last fall. And that eliminates a huge financial benefit for students from countries that are not that geographically far from Florida.
Yeah.
I mean, the state does have a lot of positives. That we have one of the lowest, or I think the lowest, out-of-state tuition rate. So that's a huge draw for international students, out-of-state students. But I think they're going to have to weigh those positives against the political climate, both in the state and more broadly, what's happening in the U.S.
Now, you've spoken with international students who are enrolled now. They are having to jump through some more hoops to keep their student visas. Let's just take another listen.
A lot of international students are giving up a lot to be here and going through a lot of stress.
That was Aaron, who we heard from earlier, but what have you heard from other international students?
Yeah, I spoke with a couple of USF students, Aaron being one of them. I also spoke with another graduate level student from a South Asian country who wanted to go by her last initial R. And she had the same concerns about, speaking on American politics, which is why she chose to use her initial. But she told me that her image of the U.S. is slowly changing. She says that she's always believed the United States had this reputation for valuing diversity and their contributions from people all over the world. But lately, the rhetoric that she's hearing from both state and federal leaders and like seeing these policies being passed on immigration and student visas and even diversity, equity, and inclusion, she said these things seem contradictory to those principles of freedom and inclusivity that she believed the U.S. stood for. So both R and Aaron, they've said that they're closely watching what's happening politically. They're aware that there's tension and attitudes are changing when it comes to foreign students and even foreign workers. And R told me, she feels safer now. She's already here studying at USF, but that doesn't mean she's not thinking of other options or they have friends or peers that are thinking of maybe going to a different country for work after graduation. And like Aaron said, international students sacrifice a lot to get an American education. The exchange rate in their home countries might not be favorable, so it's expensive to come here.
Yeah, indeed. Lots more to cover, but we've been speaking with WUSF's Nancy Guan about her reporting on international student enrollments. And for more reporting, you can go to WUSF.org. Nancy, thanks so much.
Thank you.
Well, coming up next, so much winning. That's if you're a USF sports fan. We'll talk about Bulls' success and more in a moment. That's when Florida Matters Live and Local continues. Stay with us.
I'm Peter O'Dowd. The White House slashed funding for health research in 2025. A brain surgeon who studies childhood cancer has felt it.
It's been a roller coaster these last 12 months. We've faced an unprecedented level of changes, and that's caused a great deal of disruption to research programs like mine.
More next time, here and now.
Coming up at 1 after Florida Matters Live and Local.
Marie Selby Gardens presents the Jean and Alfred Goldstein exhibition series, Alexander Calder, The Nature of Movement. Explore Calder's interests in science and nature and the circus. February 8th through May 31st. Details at selby.org.
What's my New Year's resolution? Having a more consistent wake-up time. Hi, I'm Leah Leiden with WUSF. If you're like me and want to start your day feeling informed and empowered, subscribe to the Wake Up Call newsletter. It comes to your inbox every morning, Monday through Friday. It gives you tidbits of news about what's happening in Tampa Bay and across the Sunshine State. You can subscribe at WUSF.org. Have a happy new year and stay strong in those resolutions.
Want to be in the know, but you don't have a ton of time, especially in the morning? Well, the Bay Blend podcast from WUSF gives you the latest news and events in the Tampa Bay area in just a few minutes. It's fun, it's quick, and it's all about your community. Check out the Bay Blend weekday mornings wherever you get your podcasts at.
Welcome back to Florida Matters Live and Local. I'm Matthew Petty. The University of South Florida is experiencing a bit of a sports renaissance at the moment. The women's basketball team is considered one of the all-time great teams on campus, and it started 2026 with 2 straight wins in the American Conference. National attention also went to the football team's rankings. They bulldozed their way through the fall season with historic wins, including defeating the University of Florida in September. And on Saturday, the women's basketball team won against the University of Memphis.
90-81. So South Florida gets the win for their 8th straight over the University of Memphis, 90-81 with the win.
All right, so if you're a USF sports fan, how are you feeling about your teams? What do you think about USF sports in this moment in time? Call 813-755-6562. You can join the conversation there. You can also send us an email, floridamatters@wusf.org. So this success has elevated the sports program's profile, and unfortunately for Bulls fans, the loss of coaches and some players heading to opportunities elsewhere. For the football program, it meant head coach Alex Galesh leaving for Auburn and 8 players going with him. And the women's basketball team said goodbye to their coach of 25 years, Jose Fernandez, as he left for the pros. Less than 2 weeks before the start of USF's regular season, he was named coach of the WNBA's Dallas Wings. Well, for more on all things USF sports, we're joined by Spectrum Bay News 9 sports reporter Catherine Smith. Catherine, thank you so much.
Thank you for having me.
And Noah Vinsky, the managing editor for the USF Oracle. Noah, thanks for coming back.
Thank you.
All right, so let's start with you, Catherine. You've been covering sports in the area for decades. Has this kind of movement from USF sports been seen before?
Oh, no. I think what you're seeing happen at USF, and I love how you said Renaissance. You said it much. You said it so much better than I just did.
I'm going to get some grief for that. I put the emphasis on the wrong syllable.
No, it
That's right.
sounded so cool, much cooler than mine. But no, what's happening at USF is so exciting right now. I think what you're seeing is USF really finally coming into its own. This is a university that has been known as a commuter school for so long. And I think the sports programs are helping them become more of a campus life where students want to hang out on campus. And we're going to have a beautiful stadium in 2 years. I'm going to drive.
We can sometimes hear the kind of pile driving happening across the way there.
Yeah, I want to drive by on the way out of here because it changes every time. And I will say it literally changes the landscape of this campus. When they built the indoor facility, it was so cool pulling up on campus because you felt like you were on a real university campus. When that stadium is finished, it's going to be a game changer for USF. It's going to help them in so many aspects, especially recruiting.
Yeah.
When you want to get guys to come play for your team, you're going to show them around that facility, and a lot of them are going to buy in just because of it.
Noah, what about that? I mean, I wonder about the mood on campus. Are you kind of getting a sense that people are really buzzing about sports now?
Yeah, I think just from a student journalist perspective, I've been covering USF sports since 2022, and I think the ascension has been really just from a student interest perspective. Obviously, with men's basketball, it kind of started when Amir Abdur-Rahim kind of kicked into gear that ascension when. They went on that big winning streak, and he started to you saw him really start to interact with students on campus. He used to give out free Starbucks, and I think that really started this. I don't want to say trend, but this renewed interest in USF athletics. You started to see the Yingling Center that year, sold out games. I think they had like a few consecutive sold out games, and that's really translated into football this year. Obviously, I think that the general thing is if you build it, they will come. If you have a successful program, if you have a successful team, it doesn't matter that this football team, 25, 30 years old, doesn't necessarily have the history and the reputation of a UF or an FSU. But if you put a successful product on the field, the students will be interested, and you'll have some great student input.
Yeah, and that's going to have it's going to translate to kind of better recruitment, better development, more fundraising, presumably.
Yeah, I mean, I think so. If you want to,
well, and more money.
Yeah.
I think you can look at what the University of Miami is going through right now. That will be playing for a national championship. 20 years ago, the University of Miami was in trouble. They had a huge recruiting scandal that went on, and their administration was not supporting their athletics, and it suffered. Well, next thing you know, you start seeing some money being put into the athletic programs, specifically their football program, and they've got the support of the administration now. You're starting to see that at USF. The money that is coming in to the athletic programs is unprecedented here at USF,
and where's it coming from?
It's coming from some big time donors. You've got some guys like Rob Higgins and Derek Brooks who are hitting up the movers and shakers in Tampa right now. We've got some deep pockets here in Tampa, and they're finding the right people to fund some of these big big stadiums, big athletic programs.
Yeah, and Rob Higgins, as you mentioned, he's the CEO of athletics, right? So they've kind of created this new sounding position. I mean, some of the role, I should say, is kind of similar to what was the role he replaced before, but it's a little different, right? He's kind of more expansive.
It's more expansive, and I think you're seeing the change in college athletics, specifically college football. It changes by the second at this point. The NIL money, the transfer portal, all of that comes into play. And when you look at an Indiana that will be playing Miami for the national championship in a week. They were nothing, a couple of years ago. They were a basketball school. Well, all of a sudden now they are the number one team in the nation. They will probably win the national championship, and they're doing it without 5-star recruits on their football team. That used to be the old standard, the blue bloods that would win these national championships. They were loaded with 5-star, 4-star recruits. Not anymore. It's the transfer portal. It's the NIL. And what USF is doing is setting themselves up to be competitive in that market.
If you're just joining us, we're talking with Spectrum Bay News 9 sports reporter Catherine Smith, and also with us Noah Vinsky, managing editor of the USF Oracle, talking about sports. Now, if you've been following Bulls football or the women's basketball team or other sports, what do you make of all this momentum? Call 813-755-6562. That's 813-755-6562. You can also email FloridaMatters@WUSF.org. So NIL, that's name, image, and likeness. Just kind of explain in a nutshell what that is.
That is blown up college sports, right? No, You've got guys that I'll give you a great example. We've had some really good football players at high schools in the Tampa Bay area that have gone on to Division I schools. We had a kid from Armwood High School right down the road that he set foot on campus at the University of Miami in last January and immediately had $650,000 in his bank account.
Right.
That's the kind of money that NIL is bringing in.
And before they couldn't. These student athletes could
not
do that.
They could not. But now it's become kind of like free agency in the NFL and why the transfer portal is so active this year. You've got 4,500 college football players that entered the transfer portal this year. That is, do the math with me, Noah. I think it's 31% of all college football players. That's a lot because the money is out there and they all have agents now, and they're, a lot of them are chasing the money.
Yeah, what is that like? Noah, as a covering college sports, that must have really changed what you do.
Yeah, college sports it's a business now. It's a business where you have to, from a university perspective, you got to commit significant financial resources to. And USF has shown a willingness to really, revenue sharing is the new shift in NIL, where universities can directly pay players, and USF is maxing out that you can commit $20.5 million, I believe it is now, and USF is spending as close to the cap as it can, because that's just what you got to do in college sports now. The transfer portal has almost turned into a type of free agency like we see in the professional leagues, where it's, if you want to get a good quarterback for a year, all right, let's shell out $2-3 million, and you'll probably get one of the better quarterbacks that has entered the portal.
Yeah.
So, and it's created a sense of frustration among fans where you see players, go to 2, 3, 4 schools, and it's tough to kind of get that buy-in as a fan where you're watching a team this one year and, you see a quarterback who, maybe he's one of the best in the conference.
Right.
Well, you'll have a team that'll come in and offer him, this money to leave the school. So it's really, I get the frustration from a fan perspective.
Yeah.
You've seen it.
It's changing the kind of the way college sports is done. I wanted to ask real quick about the coach leaving, or the coaches, I should say, leaving. So you got the football team and the women's basketball team losing their coaches. Does that sort of hinder the momentum the teams were building?
I think it changes it a bit. Brian Hartline here, he's done a great job, entering with the portal and utilizing that. Unfortunately, it's just another thing in college football now. A coach leaves, and so do all the players. And I think the numbers up to 10 USF players. A lot of those offensive starters that you see, and obviously star quarterback, Byron Brown, Keyshawn Singleton, two of those leaders of that offense are now headed to Auburn. I think Hartline's really hit the portal and utilized that. USF's first in the transfer portal rankings in the American. Gotten some replenished that offensive unit. But
yeah,
I don't think it kills momentum. I think it really it changes things, because when you have to hire a new coaching staff, and it definitely changes a lot.
Just in the last 30 seconds we have here, Catherine, how do schools keep their players then in this kind of new era of money and money being thrown around?
Pay them. I go back to the line in All the President's Men. Follow the money. Follow the money. That is what college sports has become. I think you will still see guys that are loyal, that still it's going to still matter to them to wear the uniform and represent the school that's on that uniform. The more successful players, probably not.
Yeah.
But I think when you look at what Indiana has done, I think they're kind of the template of how you succeed in this new world of college sports. Yeah. They have figured out the transfer portal and an NIL, and other schools are going to have to.
Yeah. Catherine Smith, Bay News 9 sports reporter, and Noah Vinsky, managing editor of the USF Oracle. Thank you both for joining us.
Thank you.
Thank you.
Well, tomorrow on Florida Matters Live and Local, we'll be analysing and reacting to Governor DeSantis' State of the State speech, and we want to hear from you. What do you want lawmakers to focus on this year? Call 813-755-6562 and leave a message and join the conversation at noon. Well, that's our show for today. Florida Matters executive producer is Grayson Doctor. Our producers are Amelie Horace and Quincy Walters. Our engineers are Jackson Harp and Gio Garvin. Warren Buckholz handled the video today. You can subscribe wherever you get your podcast and watch on WSF's YouTube channel. Thanks for being with us.
European tourists have used sleeper trains to get from city to city for decades. But running trains 24/7, it's expensive. And some countries now question whether overnight trains are worth it. That's next time on The World.
You can hear The World today at 3. You're listening to WUSF 89.7 Tampa, broadcasting from studios at USF Tampa and USF Sarasota Manatee.
Listener support powers WUSF. Funding also comes from Humana and Ravello Medical, dedicated to offering whole-person health and wellness through health plans and healthcare. Other providers are available in the Humana network. Providers may also contract with other plan sponsors. Learn more at healththatcares.com.